Greetings of the day, dear doctor. I welcome you to the class of Kidscovery. Myself, Dr. Parv, and the topic of discussion for today's class is Osgood's disease. Some people call it as Osgood's disease, some people call it as Osgood-Schlatter disease. So let's quickly understand what exactly the thing is. Now, from the basics of your anatomy, I hope that you know that this is something which is called as tibial tuberosity. Okay, tibial tuberosity. So here you can see fracture which is present in the tibial tuberosity. So this is called as tibial tuberosity avulsion fracture. Tibial tuberosity avulsion fracture. But if you carefully see at this, there is a loss of, there is a loss of the sharp margins. Now this tibial tuberosity is no longer sharp. Okay, tibial tuberosity is no longer a sharp tuberosity. Okay. And if you see on the patella also, you will be having a thickening of the distal portion of the patellar tendon. Okay, so this patellar tendon is also thickened enough that it is visible. Okay, so basically what is Osgood-Schlatter disease? There is a loss of sharp margin, number one, and second is there is a thickening of the distal portions of the patellar tendon. This is second point. Okay, so why it is happening? Because see, the Osgood-Schlatter disease is also called as osteochondritis of tibial tubercle. So basically the tibial tubercle, or you can say the tibial tuberosity, is going to show you osteochondritis. That means there is an inflammation of the cartilage which is attached to the tibial tuberosity. There is inflammation of the bone, there is inflammation of the cartilage. So basically there is an inflammation of the secondary ossifying center. Okay, inflammation of the secondary ossifying center of the tibial tubercle due to the traction of patellar tendon. Okay, so basically it's a osteochondritis. Osteochondritis, why I am telling you like this? Because it is the inflammation of secondary ossification center. Secondary ossification center of the tibial tubercle due to the traction of your patellar tendon. Due to the traction of your patellar tendon. So what happens? See, because repetitively, if you are using your tendon, like in the extension, in the flexion of the knee, it is used. So if we are using it like a repetitive strain or overuse, that causes what? That causes microavulsion. Microavulsion means there is going to be avulsion of the tendon, but a little small microavulsion of the secondary ossification center of the tibial tubercle. So basically tibial tubercle has got a secondary ossification center, and if you are continuously using your patellar tendon, that causes the avulsion, okay, microavulsion of that tubercle, that causes the Osgood's disease or the osteochondritis of the tibial tubercle. So generally during the growth spurts, what is going to happen? The elongation of the limbs are going to happen, and of course your quadriceps, patellar tendon is formed from the quadriceps only, so quadriceps are going to pull that area, okay, and that can lead to the osteochondritis. So basically it's a disease which is seen in the adolescence age during the growth spurts. So most commonly these are seen in males. Okay, Osgood is seen in the males. Okay, so for all the males out there, good. Okay, good. So good is who? Good is male. Okay, so Osgood's disease is more commonly seen in males. Coming with the risk factors, so it's sports with the running injury, jumping, okay, all these things. Usually it is unilateral, maybe bilateral also. Okay, usually it is unilateral because the sports and everything, generally one limb is something which is more in use. Okay, and coming on to the clinical features, of course the child is having chondritis, inflammation, so knee pain is something which is going to be there. Of course, there will be tenderness, enlarged tibial tubercle on palpation. Why enlarged? Because of inflammation. Edema is the one of the integral features of inflammation. So we do a test that is called as kneeling test. Okay, so the child is or the patient is asked to kneel down, and once the patient kneels down, the pain is going to get increased. And sometimes we tell the patient to extend the knee, and active extension against the resistance is also going to provoke the pain because it is going to have. So I've told you, flexion, that means kneeling down, extension, that means you are doing the test. In both of these conditions, the tibial tubercle, the patellar tendon is involved, so that's why it is going to be having the causing the pain. So what will be the radiographical features? I've told you that one important thing is the irregularity and fragmentation of the tibial tubercle that is going to happen. And the next thing is these yeah, so can you see the irregularity here? See one piece, second piece, third piece. So it's actually irregular. Okay, why it is irregular? Because of the inflammatory processes going there. Okay, so because the inflammatory processes are going, so these are responsible for causing the non-uniform or irregular contour of the tibial tubercle. So what to do? So in already I think in the orthopedics class of osteomyelitis, sir must have told you that for any acute condition which is related to bone, please don't touch it. Okay, don't touch it, don't do any surgery on that. So there's a very simple dictum in the classes of orthopedics which our professor used to teach us, that acute ko chedo nahi, chronic ko chodo nahi. Okay, so something which is acute, please don't disturb it, whereas something which is chronic, please don't leave it. Okay, so simply if it is acute, you have to do the conservative management, and the mnemonic is PRICE always. So P for painkillers. Okay, so some analgesics like your NSAIDs etc. you can use. Okay, analgesics you can use. And what is R? R for, of course, rest. Okay, so if the pain is tolerable, the patient can continue sports, otherwise rest is something which is given. Then I for ice application, I for ice application. Okay, I and C together, these are ice application only. And then E for elevation of the limb is also indicated. And of course, the right hand of all the orthopedic surgeons is the physiotherapy. So of course, physical therapy like stretching and strengthening exercises are also done. Once the inflammation turns out to be chronic, then you can do the excision of the ossicles. You can excise the small parts, ossicles. Okay, so when we do that, if the patient is skeletally mature, or if the condition is refractory, okay, it's occurring once and then again and again, so then we can do what is the complication. See, if you immobilize the patient for a longer period of time, the quadriceps muscles which were responsible for giving you the tendon of patellar tendon, so they are not going to work much, and since they are not working, so it leads to quadriceps wasting as well. Okay, so this is all about the disease Osgood-Schlatter disease, the disease which is very common in adolescent age group. So make sure you do it by heart, because yes, it's an important topic for your PG exam as well as your university vivas. Thank you.